There's really an attack on freedom to discuss the whole nature of the cardiovascular system. Most medical doctors are constrained. What you find is that there's really what we call a reductionist narrative in scientific and media establishment. Basically, it's not holistic. Everything's centered around cholesterol, cholesterol, cholesterol. There's an emphasis on treatment, not prevention. Moreover, there's an over-reliance on drugs, statins, blood thinners, blood pressure medication. There's no consistent guidelines anyone gets on diet or exercise. Frankly, broadly, there's really no discussion of alternative. What you do see when it comes to cardiovascular diseases, you got to take Lipitor, you got to take Entresto, you got to take Eliquis, or you take an aspirin. That's probably the closest you get to something potentially valuable. It's really about drugs, drugs, drugs. This is where most of the quote unquote discourse is. This is where freedom's really constrained, where not everyone gets an equal airplay. If you're talking about other stuff, you're eating away at people's profit and market share, right? So there's a huge motive to keep the discourse on this and really not have free discourse in other areas.